Good day, my name is Samantha Florinosos, and today I will be doing a return demonstration on Leopold's maneuver. So Leopold's maneuver is done for us to assess or to know what is the presentation of the fetus inside the mother's uterus, the position, the attitude, and the degree of descent. So first and foremost, I'm going to wash my hands because this is a universally accepted precaution and that should always be observed. Next is I'm going to explain the treatment or the procedure to the patient. Good day, ma'am. My name is Samantha. I am a student nurse, Samantha Florinosos. And can you state your name, age, and birthday, ma'am?
I'm Gloria Galisa, 22, 2001.
Okay. Ma'am Gloria, which language do you prefer in conversing, ma'am? English, Bisaya, Tagalog?
I'm okay with Tagalog, Bisaya, and English.
Okay, ma'am. So, I am again student nurse Samantha, and today I will be performing Leopold's maneuver to you. So, ma'am, this is done to assess and to determine what is the presentation of your fetus inside your uterus or your abdomen. So, this presentation, ma'am, meaning is katong gina-expect na itong mauna mo gawas during vaginal delivery. This will also help us to determine the position of the patient, the fetus, if it is in horizontal, in a vertical, or in oblique position. So, also, ma'am, may bala na ito rin yung attitude sa fetus inside your tummy, and as well as the degree of descent, if it is engaged or still floating. So, ma'am, I will be putting pressure onto your baby bump or your abdomen, meaning mura ko ga-massage. Dapat, makafeel ka pressure, ma'am, but not discomfort. If ever makafeel ka o pain or discomfort, iingon tayo sa ako, ma'am, kaya aram ma-discontinue na to ang procedure, address na to ang tenderness na yung mga tulog during my palpation. Okay, ma'am? Explaining the procedure onto the client will help to establish rapport and gain their cooperation throughout the procedure. So, karon ma'am, nakaihi na ba ka, ma'am?
Wala pa, ma'am.
Okay. So, kailangan na ito mag-ihi, ma'am, no? Kaya aron, atong bladder di full. Pag full atong bladder, ma'am, ano itong uterus, ma-deviate siya or ma-ato siya sa lain na line. O, sa ako, during the Leopold's maneuver, dili ko kakuha og accurate assessment if deviated in mong uterus. So, mag-ihi sa taon na mga habang ina-prepare na kung daanan mo. Okay, nakaihi na ka, ma'am.
May naman.
Sarado lang sa anak kong window o door, ma'am, for your privacy po. So, karon ma'am, pwede na ka mahigda, ma'am. Pwede na ka mahigda, ma'am. Okay. So, ask na po, ma'am, hanga. Kaning lift na to atong hips. In a count of 3. Kaya aron libutan na ko ni roll below. Ilalong sa mga right side dito. 1, 2, 3. Sige na, ma'am. So, kana siya, ma'am, kay dili man gud sa tong right side, ma'am. This is where our large blood vessels nakabutang. Tapos kay dako naman itong uterus, na siya possibility nga maipit imong large blood vessels which can cause supine hypotensive syndrome. So, next, ma'am, is kailangan na ko i-drape sa taka, ma'am, ha, kaya really ka mag-feel ka comfort na kung di ka tugnaw. Okay lang kasi makatugnaw, ma'am, no? Or init na tayo.
Yes, ako.
Ma'am, karon, ma'am, ano na to, ma'am, flex na to gamay atong legs. Okay lang, ma'am. Kani, ma'am, kaya ang dili ma-tense yung abdominal muscle, kaya I can perform the Leopold's maneuver efficiently. So, next is I will first perform the first maneuver, or what we call the fundal grip. So, but before that, I will first warm my palms or my hands. It is because to keep my hands warm, because upon palpation, cold hands tend to may tense the abdominal muscle, and tense abdominal muscle may change the assessment or the findings that I may get. So, ma'am, expose na po yung mga ma'am. Start na po, ma'am. So, now I'm going to warm my hands before palpation. So, first is the fundal grip. This is to determine which part of the fetus is at the fundus of the uterus. So, we do this in grasping the fundus of the mother's abdomen. Okay? So, diri ma'am, wala na po kung unsa sa dapit unsa ang nasa taas sa inyong uterus. So, this, naka-feel ba tag pain, ma'am? So, kanin ako na palpate diri is something nodular and soft. Meaning, if soft and nodular siya, ma'am, meaning, ang naa sa imong fundus or ang nasa taas sa imong uterus is ang reach sa imong baby or yung buttocks. Okay? So, next maneuver is what we call the umbilical grip. So, what we're going to do is both palms, the side of the abdomen, the other one is sliding downward to palpate which side is the fetal extremities or the which side is the fetal back. So, while the other hand is giving support to the hand that is palpating. So, like this, on my right hand, I am palpating the left side of the mother's abdomen. So, right here, ma'am, I feel the fetal extremities kasi nodular siya, ma'am, may mga bump. And here naman, sa right side nimo is naadiri ang fetal back, kay flat and long structure lang siya, plain lang siya, ma'am. So nasa right side ang fetal back and nasa left side ang fetal extremities. So, the second maneuver is done. We'll proceed to the third maneuver, which is the pollex grip. So, in this maneuver, I am going to grasp the symphysis pubis of the patient or the mother, and then using my right hand, and then try to determine the presenting part. So, the presenting part, if it is round, then therefore if it is hard and round, therefore it is the vertex or the head. But if it is something that is soft and nodular, then therefore it is the buttocks. So, karon ma'am, ang na-feel na ko diri sa symphysis pubis kay ang imong hard and round siya, meaning presentation sa baby is vertex or ang head. So, ang gina-expect nato nga mauna makita sa vaginal delivery is ang head sa baby. Which is good, ma'am, no? Ano siya ang ideal position sa fetus inside the uterus. And then now, I'm going to slightly move my head to determine my palm or my hand to determine if the head or the presenting part is engaged or still floating. For this, movable pa siya, which indicates the presenting part or the head is still floating. But if it is not movable, then therefore it is engaged. So now I'm done with the third maneuver. I'll proceed to the fourth maneuver, which is the pelvic grip. So in pelvic grip, I will face the patient's feet this time, and then both hands or both palms, I will put it on each side of the abdomen, and then slide it downward to the pubis or symphysis pubis. This is to confirm the third maneuver or the findings we able to determine during the third maneuver. This will also help us to locate the prominent part of the vertex or the head, so that we'll able to determine if the head is flexed or extended. So what I feel here upon palpation is that the prominent part of the head is on the same side of the small part or the fetal extremities, which suggests that the presenting part of the head is well flexed, And that is the ideal position of the fetus inside the uterus, ma'am, which is a good news. So now I'm done with the fourth maneuver. I will then locate again the fetal back. So this time, this is to hear the fetal heart tone or to listen to the fetal heart tone. We also need to note for its rate, character, and again the tone. So here, it's on the right side, the fetal heart back, the fetal back. So the fetal back, we're going to put the stethoscope at the right lower quadrant of the patient's abdomen, since the presentation part is the vertex and the fetal back is on the right side. So therefore, we put the stethoscope or the diaphragm of the stethoscope at the right lower quadrant. So we always need to make sure that we warm the stethoscope before putting it above the abdomen of the patient. So malinaw lang po sa baby mama. This is to determine if the condition of the baby inside your uterus. So I'll listen in a 1 full minute. Okay. So the fetal heart rate I was able to obtain, ma'am, is 130 beats per minute, which is within the normal range, because the normal range is 120 to 160 beats per minute. So that's good news, ma'am, no? And then according to characteristic naman is good naman ang condition or ang beat sa baby. Next is, now I'm done to the Leopold's maneuver. I will then put the patient or the mother to comfortable position. So ma'am, i-drape na ako balik, ma'am, ha? So bumanata, ma'am, sa ato procedure sa Leopold's maneuver. So as I said before, sa fundos na ang bridge, sa imong presenting part is ang head, and the fetal heart tone as well as the fetal heart rate is normal. So next is, I am going to document all the data that I have obtained, the findings that I have obtained. This is because documentation is a must. In my documentation, I will note for the position, the presentation, the attitude, and if it is engaged or not. Also, I will document the fetal heart tone, fetal heart rate, its characteristic. And that would be my Leopold's maneuver return demonstration.